Nursing Anxiety Affects Patients During Death and Dying, a research funding proposal presented by Jennifer Brown. Hello, I'm Jenny Brown, RN, BSN, currently a full-time student while actively working in the community as a hospice and palliative care nurse, and pursuing my degree as a family nurse practitioner at Regis College. In my prior experience as an ICU nurse and then an ER nurse for the last 8 years, I was able to speak with fellow nurses and observe them while caring for patients at end of life. Many shared their experiences in not feeling comfortable caring for patients and essentially allowing them to die. In their recount, often expressed their own anxieties and mortality during this process. These observations at the bedside is what has fueled this research concept, more specifically the lack of end-of-life education within the medical profession, and this presentation will outline the research proposal in a quest for funding the project. How do nurses support a patient and their families in what is defined as having a good death? And is nursing bias and death anxiety an obstacle to a patient having a good death? Death and having a good ending, including grace and dignity at end of life for the patient and families involved, without conflicting influence from the nurse or medical professionals providing that care. Elizabeth Kubler-Ross's model for death and dying is touched upon during many nursing classes. However, there is no formal education in regards to the dying process of the patient. In previous research findings, nurses and medical professionals often volunteer the information that they are not taught how to support a dying patient. The summary of the information and research conducted here enables a foundation of medical professionals' thoughts and reflections to their own experiences with death and dying, either from personal versus past trauma to the current conflict and worldviews being changed by a global pandemic. The critical elements in the review of literature include education and years of experience of the subjects involved. They are not limited to the instruction provided before the studies, but despite it. As a culture of caring is established in the medical profession, it is possible to view death with compassion, despite our thoughts and emotions surrounding the death and dying process. Gaps have been identified in the review of literature. As identified gaps in the review of literature would be including a cross-sectional study that implicitly identifies differences in the culture surrounding death and dying with the imprint that they may have on the medical professional's ability to care for the dying patient and support the family in the dying process. The idea of including culture into the data being collected may help to identify other gaps in research and the ability to adjust education platforms to fit the culture of cross-cultural experiences of the diverse medical populations. Death anxiety and compassion fatigue in critical care nurses, as seen with Morgan, Bailey, and Duty in 2021, an integrative review to identify how nurses practicing in inpatient specialists, palliative care units uphold nursing values, maintaining professional nursing boundaries may become increasingly difficult when faced with mortality and self-limiting mortalities. The survey will help to identify the multitude of causes and obstacles in maintaining professional nursing boundaries when caring for dying patients. In summary, this study replicates and extends previous research demonstrated variability of the self-perceived end-of-life care competency of interdisciplinary hospital staff. Specifically, the study's findings highlight the continued disparities between physicians and nurses concerning end-of-life care competencies and expanding understanding of the end-of-life care training needs beyond these two disciplines. Furthermore, the results provide evidence for the importance of assessing healthcare providers to identify their specific training needs before developing educational training programs on end-of-life care. Future research examining the effectiveness of this targeted end-of-life care education is needed and as an important next step in providing the care of individuals with life-limiting illnesses in the United States. No research can be conducted without the assistance of funding. While the majority of modern medicines are results of hard work, dedication, and insight, it is important to recognize that their presence would not have been possible without the additional substantial research funding. This Medicine at Work a nurse being present at the last breath of a human soul is nursing at the core fundamentals when we think of compassionate care. While many medicines or new surgical advancements are in the spotlight for funding to follow the FDA approval, one thing is certain in this life is that we will have an end. During this extensive time period, research funding is needed to keep any project alive. Derived through government grants and public taxes or private investments, these funds are the very lifeblood of any research program. So, it is clear to appreciate the massive impact that funding will have in regards to the medical and scientific process. As this industry continues to advance, even larger amounts of capital may be needed to secure a safe and healthy future for mankind. With a healthy future comes a compassionate dying experience. As nurses and medical professionals, we can aid in that process if our foundation is built from the beginning to help a patient on their journey. Thank you for your time today and your consideration in funding this research project.